and we should see starting.
We're not
We are
upside down
live.
screen.
I don't know if we're upside down. Anybody?
We're sideways.
Yeah, they've notified subscribers that we're on. I don't see anybody coming in, which is a little concerning. Oh, there we go. People are starting to come in now. Anybody who's coming in now, can you let us know if we're sideways for you? Can somebody just say all good, or we need you to turn the phone? We've never done this on the phone, and we're live in Nashville. I'm just gonna, right, I'm gonna assume that we're good.
You just rotate it, and then maybe we'll know otherwise. Anyway,
All right. Somebody can let us know if we're sideways. Just put a little note in the comments. Turn phone. Yes. Okay. Yes, sideways. Okay. We'll just sit closer to each other. All right. So, Carter, Food is Health Live from Nashville. We're here. Everybody read about it forever. I'm going to like really sit right next to you right now. All right. So, we spent the morning.
we spent
System C.
4 hours.
Yeah.
Talking about what is System ABC. We had a room full of 50 people who were all from Bob Jones at Chef's Garden to Dr. Joe to other people really trying to figure out their role in the system. And then we sort of walked through from dirt, I am a biologics company focused on improving nutritional quality all the way up through to how does that affect the healthcare system? And so trying to help everybody see what part they play in that overall system, which is hard for people to see sometimes, but
Yep. So the systems we broke down were systems A, system B, system C. So system A is basically inherent health. It's what evolution gave us, but it's not scalable.
and it optimized really just for survival of the species, not
Correct.
longevity.
Correct.
So once you procreate in system A, we don't need you any longer.
Okay. Then we moved to system B, which is what we have today. We wanted to solve for famine, needed shelf stability. We wanted people to stay alive as long as they could. Right?
Cure cancer.
Right. Moonshot medicine, we call it.
Moonshot.
But we created the acute care system and we created cheap calories. And what we didn't realize we were going to get when we did those two things side by side is we would end up with a chronic disease epidemic that costs our country 5.3 trillion in
a lot
healthcare expense, plus the 2.6 trillion that we spend on food. So, system C. There's Brad. Hi, Brad. We were with Emily all morning. We say she says hi. So system C is what we're working on designing, right? So you take the best of system A, the best of system B, and you get system C. And system
pay attention to the evolution,
right?
figure out the right business models to help scale it.
Yep.
And deliver better outcomes at a lower cost.
So we spent the morning. We did an overview of the system design for everybody. We had probably half the people knew us, half the people did not. So we had newbies in there, and then we had folks that have been there for a long time. And then we did a big conversation. We let everybody introduce themselves, talk about what they're working on. And so I just want to talk about what we both observed in the room. So there were about 60, we were somewhere between 50 and 60 people. And everybody was highly engaged. I think and like Carter, you said, is, I mean, we had everything from truly soil to cell. Like we had the full spectrum, everything along the chain. I think what was not surprising for me, but what I saw was everybody in that room lives in system B. That is our current state. And it is extraordinarily difficult to pull yourself out of system B to think about a better state. And so there's a ton of really good system B plus work happening, but everybody it's a real challenge to put your system C hat on and say, what do I really want to do here? Like, where could I really take this? How could I create a human outcomes economy versus how can I just make sure my company is successful? How can I do a better job?
Well, it's because it's foreign. So we use the analogy of reusable rockets. So when Elon Musk 20 years ago said we're going to make reusable rockets, people thought that was sort of an interesting idea, but they still designed expendable rockets. And it really took 20 years of effort to get to a point that people could really see the economic benefit work. I think it's a challenge for people to say, well, wait a second, we're going to change the food system and get rid of chronic disease. Like, we're always going to have chronic disease, but we didn't always have chronic disease. Chronic disease is a relatively new thing in human existence. It's really something that sort
Should
of
we like
crept
get
in.
Yuri? Should we like
We
be
could
like
get, you want
Yuri?
to talk
You
about
want to?
chronic disease? You can hang over our
We're
show.
like doing a live stream. You can like come in for a minute. I said we might have some surprise guests. Here, come
So
here.
we've got chronic disease is something that
Right
really chronic
Hi.
disease was something that sort of showed up in the last 100 years.
Yeah.
We've lived, humans have been around for 350,000 years without it, and we can make it go away. It's
And
still hard for
Yuri's-
people to see that.
Yuri's
Yuri's
working on it.
doing it.
Yeah. So tell us who you are. Yuri walked in to get his bag. He joined us for breakfast this morning. And
Well, I'm Yuri Sadakar, CEO of Nudge Health, and we are a tech-enabled lifestyle medicine, mental health service that integrates evidence-based interventions with physicians into their clinical pathways as they see polychronic patients who have mental health comorbidity and all the range of chronic disease. It allows them to order our service and partner with them to really help these patients longitudinally. And we're seeing really exciting outcomes, disease reversal, and significant cost savings impact when we do this program at scale. So, yeah.
There's an example that you can reverse, slow down, get rid of chronic disease, and you're doing it.
And doing it in the fee-for-service environment.
Yeah.
Medicare, Medicaid, commercial. And I always say we're delivering value-based care in the fee-for-service model, but there's plenty of opportunity to take this to, the other opportunities, self-pay, self-insured, and other value-based arrangements.
And you're in the price range where someone's going to do GLP-1 or do yours, or I mean, you're really in a price range that
or provide wraparound services around GLP-1s because many employers and health plans really struggle covering those. And if you don't have these types of services traveling with and companion with the patient who's getting the GLP-1, you may not see the health outcome or the cost effect.
so tell us, tell everybody what exactly, like, what is the sort of journey? What's the patient journey when they're part of Nudge?
Mhm.
And then let's talk a little bit about, you were there this morning, and just like the good, sort of like observations you made, and anyways.
Yeah, I mean,
Sorry, I just like threw you.
Totally. And I don't want to take up all this time.
No, it's fine. This is great. This is way more interesting than everybody just staring.
Well,
at
I mean,
the
typical journey is patient comes into their cardiologist or their primary care physician visit, and they have about 15 to 20 minutes with their physician, and we partner with their physician to be able to say, hey, the physician says, I've actually got a program that will help with your emotional health, your nutrition, your exercise, your sleep. It helps me monitor these risk factors with you. So I'm going to put in the order, and the team's going to follow up, and the team follows up. And we've got a whole tech-enabled service that interacts with the patient, and then we bring an entire lifestyle medicine clinical team.
What is that? Like, so when somebody is having, when they're getting lifestyle support, what does that entail?
Yeah, so we'll call the patient, basically do a wellness assessment with them, screen them on what areas are acute. Oftentimes patients will say, I need help with nutrition, but they've gone through some trauma. And we know there's this huge correlation between mental health and physical health, right? And so oftentimes getting into their what is going on in their life and their why, right, really helps us understand where do we want this patient to really start, where will they find even small success so that they can continue to advance in their journey. So we'll call them up, enroll them, and then we actually do virtual longitudinal care. So they'll join interaction like this on video or on the telephone. They'll join one-on-one and group sessions. And everything we do is measurement based. So we are measuring and tracking based on assessments, and we're we're focused on really getting those scores down, right? So showing a measurable track to treatment to target, usually 50% of those scores. So if their A1Cs are a certain profile, if their lipid panel is a certain profile, their weight, their pH9, their GAD7, all of those components that are part of whole person care, we're helping deliver that with the patient. And as they see changes month over month, we're tracking that with the provider. And our programs are sort of layered and structured over 16 weeks. So in about 16 to 24 weeks, about call it 6 to 8 months, you'll start seeing mental health scores improving. And in our data, as the data shows, when the mental health scores start improving, patients get ability to really get a handle on their nutrition, their exercise, weight starts going down, their labs start improving.
Interesting.
So, and today we were talking about today's session. Is there something you sort of walked away new in your thinking as a result, or what was the your a room full of people in the agriculture sector, food sector?
Yeah, this session was
healthcare.
honestly, it was incredible, because what you had in the room was, we're integrating with the physicians who are seeing these patients every day. But think about what was in the room. This is where all the people who are really figuring out the entire chain of why the chronic condition ends up happening in the first place. So why are patients coming in with diabetes or prediabetes? Why are they coming in with these issues? The functional reason is they don't have any health literacy. And even if they did, they don't even have access to the right foods to complement that health literacy. So when in this room, you had all the people who are saying, hey, we want to transform the sick care system, right? We all are operating in the current system, but we've created modalities, revenue streams, and workflows that we can now really design from, as you guys call it, from seed to sell, right?
Mhm.
All the way, and say, as patients, even before they have these really advanced chronic conditions, maybe there's early indicators or warnings, we can intervene with the right food, the right team, the right incentives, right at the very beginning, and transform the system, so that what's happening is premiums aren't going up on the employer or the health plan side, and patients aren't paying large out-of-pocket costs for their sick care, because they have high deductible plans.
And so does it inspire you to think, like, as you're thinking about what you're doing with Nudge and what you need to do next, does it, like, you walk away with a different kind of strategic view? Is that a thing?
Yeah, in the room, I would also say there was a lot of storefront, like retail, shopping, grocery company shop, people coming in for food and pharmacy, and we were really designing, can we use that as the gateway for patients to for members, for consumers, to get this type of care right at their grocery store, and circle back to the very place where they can acquire these foods and are not at a loss, right? Because when they're at their doctor's office, they're like, okay, I think I got this, or they're on a call with us. But imagine if this ecosystem was able to redirect the patient, incentivize them back into the store to get the actual foods that will start ratcheting down their diabetes,
or the farm directly.
Yeah, exactly.
Yeah.
Cool.
All right.
Thank you.
All right.
Peace out. Enjoy the conference. Thanks, Yuri, for playing along. I knew that might happen, so. It is hot in here.
It is.
I know. I need
I walked like several miles, like several steps over here.
Oh, okay. Several miles. So, what were your observations today?
Well, I think the people are still, we got to help people understand with examples that we can, in fact, get rid of chronic disease, and just start operating from a standpoint of chronic disease is not normal. And we should act with a little bit more deterministic kind of attitude. It's like, we're going to fix this. I think that we're a good crowd here in terms of leaning in that direction.
Yes.
But it is very hard to break from the daily job into that realm for a while and just sort of stick yourself into what the world system C looks like. And so I just feel pressure to try to help people understand how to operate from that and look back. So we're in a realm where we're going to have no chronic disease. Now I'm going to look back to the current system and figure out where I really need to prioritize, where we can grow the business that we're running, because we got to run healthy business. But two, that we're really leading people down this pathway where we can get, competitive advantage. Like if you can deliver, like Yuri, you can deliver for $3,000-$4,000 a year costs. He can eliminate really what would for a healthcare system might be a $15,000-$25,000 cost
on average.
of dealing with a patient who's going into um, a lot of interventions, whether it's diabetic shock or healthcare issues or kidney dialysis issues. That much more expensive interventions can start to be mitigated.
Yeah.
And then the question is really how do you help people see that that's achievable?
Yeah.
And it's not really a dream. So we had a good chance here of people who've led that campaign for a long time, who people like Dr. Joe and Bob Jones, who set out,
they're pioneers
in the 70s to change this, and they were one or two people doing that. Now we're thousands of people doing that, and really we've got to move to millions of people doing that. So that's sort of the next phase of the transition, but got to make it easier for people to see that it's possible.
Absolutely. I think for me, I felt like it was just the complexity of who was in that room and the challenges that every single person faces within the existing system and the frustration that's in there. That just kind of weighed on me. It excited me, but it also just, it was like, wow, there
Give me an
is.
example.
Uh, well, there were a lot of folks in there around food insecurity and, public, and, like I need to solve for food insecurity. I need to educate people. I need to connect people with this and that. But then you've got, I guess, the complexity of getting from Brad Fruth, from the seed, right, to the person who had the biologics, to Bob, to then Colleen, Bob with the regenerative agriculture that then, produces a nutrient dense food, and then connecting it all the way up through like somebody like Yuri, and the economics there's an economic barrier and friction point of every single one of those that isn't aligned around human outcomes. And so I think what excites me is that we can do this, but what I think hit me, or listening to everybody, was like, wow, this is a real stretch for folks to think about, because even within their own current friction points, they can't get out ahead. And now we're trying to connect the entire pull through. The thing is, though, when you thread it all the way through, that's when it does work, because you can figure out where you can actually move dollars from downstream back to upstream. And that's the failure, is that if you don't go all the way down, if you don't go from upstream to downstream, right? We talk about soil to sell, but in essence, we're trying to move what Yuri was just saying. We're trying to unlock downstream dollars that right now are locked into health insurance premiums because you're just assumed to get chronic disease, right? We need to make sure that this economic model is to also try to unlock those dollars and move them back upstream. It doesn't have to be through a policy or whatever. You can do that in very creative manners, even through innovation like with Yuri. But folks, I think what hit was like, people can't even figure it out in their own world, let alone, think about this future state.
Yeah. So the world model we really got to get to is,
yes,
we've had chronic disease really only for about 100 years. So it's a small part of human existence. And then we also have other advantages. So the inherent technology to improve nutritional density is understood by the emerging players. So regenerative crop sciences, where we sort of know what it is, and so it doesn't evade us. There's an exposure of getting more market demand, but we sort of know the technology. So now it's a system integration problem. How do you take that technology and integrate it into a business model and make it so you can deliver better food at a lower cost? It's sort of that problem, which is, again, not, there are lots of things that an iPhone delivers a lot for less. So that's not like rocket science. And then we have enablers. So one of the great blessings of AI is that flattens knowledge. So everybody now has access. So where you've got people who've been experts in these particular areas and understand the connectivity of arsenic to metabolic disease, where not many people understood that before. Now anybody has access to that. And then AI also gives agency to individuals. They can put their healthcare information in. If they're afraid to talk to their doctor, don't have enough time to doctor, they can start to understand their conditions a little bit better in that regard. And so they now become better actors in the innovation, so that they can, when their doctor does help them with something, or somebody else in the care delivery system starts talking to them and they don't quite get it, they can explore things on their own. So now if you've got the technology can deliver healthier food at less, and then you've got consumers who can remove the friction. Those are all part of the equation to just flatten it. And then finally, the measurement of whether it's succeeding. You can now buy a CGM for $80.
From Amazon.
You can get key blood tests for $50. You can do that without having to go to your doctor. You all of a sudden you're sort of enabling your system.
Yep.
And that wheel just starts spinning. And then within your family, a lot of people talk about behavior change. Your parents are your future, and your children are you know your future. I mean, your children are looking at you. You're looking at your parents, and you're seeing, sort of in your case, with your genetics and your situation, your socioeconomic environment, you're sort of getting a sense of
What's to come.
So you don't have to wait forever. And our ability to sort of understand today what may happen down the road, we're just more aware and have more control over it. So concerns around, it is a challenge in terms of food insecurity and such. I think we're enabling in that area of the corner. We're just enabling the tool sets to take some of the friction out of that.
Yeah, I agree. Mike Williams has this is the reality, which he says one of the toughest things is to retrain ourselves from B to C, moving from system B to system C. We have to forget what we've been told for the last 50 years. Fat and cholesterol are bad. Just take a pill. And that's so true. That's so true, because you you go to the physician and it's like, you need to lose weight. You need to eat healthy.
Well, here's one thing. If you go back to the Elon Musk model we use, it's like, how is it that Elon Musk coordinates all these different things that he does? Because he's got one focus. He wants to get to Mars. The Boring Company gets them on ground on Mars to protect them. The AI makes it so that you can have knowledge workers there without having to send more humans. The electric cars make it so that you have vehicles that can transport. If you really get to it, every single thing is focused on that one common purpose. In our case, the one common purpose is get rid of, how does food as health get rid of chronic disease? And it's going to happen.
Yeah, totally agree. All right. So what are you looking forward to? So let's just.
I'm reading this thing. It says.
That's what Mike I just read it.
Oh, you just read it? I didn't catch on to that you were reading, actually. That's pretty cool.
Are you impressed? See, I'm good at this.
You are. You're better than I am. You're the one that's always seeing this.
Exactly. I know what I'm doing. Carter never sees this. I always monitor the chat room. Carter doesn't. Well, we normally don't go live on live, although you wouldn't. I don't know. Anyways, we normally go the way we do it. So tomorrow is.
We're walking through the entire top to bottom with the people who are actually building.
But we're going to do it as a future cast.
That's a future cast. Yes.
Are you back for an encore?
Yeah, I was back to my drink.
Getting your.
This,
Do you have another idea? Did you want to share another?
no, I was just getting this.
Oh, good idea. It's a good idea drink.
It's pretty good.
Is it?
What is
it a probiotic drink?
Let's read the label.
Okay. Oh, you're going to make me need readers here. It is carbonated water. So there's
No sugars.
no, they've added, chromium seems to be, so they've added potassium, zinc, and chromium. So what does it say? Why is balanced blood sugar important? because it affects how you fuel all day, every day. When your blood sugar is balanced, it improves your metabolism, energy, mood, helps manage weight, and plays a vital role in supporting your well-being. This is good for a lifestyle medicine company.
We're going to see
here.
if
Wonder if it's true.
it affects my CGM.
I know.
Yeah, do you have your
one on?
CGM on?
Yes.
Oh, I can't wait to hear.
Drink it and let you guys know.
How does Good Idea work? Our patented blend of 5 amino acids and chromium. See, I knew there was stuff in there. I was like, well, you got a daily balance of things that doesn't come in water. Is clinically proven through. See, this is what I want to know. We need to go ask them because they're obviously here. They're sponsors.
They may be really encouraged by the fact you're giving me a free commercial.
I am. So
Does everybody know what the?
We should go get them and have them come on the live.
Good idea.
There you go.
It doesn't. It's backwards.
Oh, I don't know. Well, let me finish reading the label. So it says decades of research to reduce blood sugar. So they've done, apparently, they have decades of research on this. When enjoyed with a meal. So we should be eating. We should get these, Carter, when we finally eat our lunch at 3:00 in the afternoon. For best results. Here we go. Drink 1/3 of the can prior to a meal and enjoy the meal with it.
Ooh.
So you need to bring this to dinner.
I'm drinking 1/3 and I think I'm going to go eat a meal and see what happens.
Ooh, we can report back on this. All right. Wild raspberry or Vild, I don't know. Oh, as the Swedes say, oh, interesting. Has aromas of wild raspberries and a delicious, refreshing raspberry flavor. I had the other flavor, Vildhallen wild raspberry. Live good.
It had to be a weird name.
Lightly.
It can't just be wild raspberry.
Water support. This is so fascinating. Like, I find this really fascinating. And there's the amino acid blend. There we go. It actually has it's L-theanine, L-lysine.
Well, drinks are one of the fastest growing.
All right, now I'm going to go grab this. I'm going to go get some lunch.
Yes, enjoy.
Things ago.
Okay, all right, thank you. Wow, that was a fun little diversion, wasn't it? It's very interesting.
Should have Yuri here more often.
I know Yuri's gonna have to become. So I think what this really showed me, we were talking about tomorrow. So tomorrow you were teeing it up, but we're gonna bring it to life. And I think what today showed me was just how hungry and how much of a need there is to tell the story. So I feel more of a sense of responsibility that we need to tell the story tomorrow of what 2050 looks like. I know that's how we've mapped tomorrow out, but now I can see that
it's well prepared.
I know, but we've never done that before. So we'll see.
Okay.
All right. So is that it?
That sounds good. Okay. I'm ready for lunch.
We're gonna eat our lunch. I guess I'm gonna need to go get a drink and we can report that. I don't have a CGM, although I do have. If anybody's worried, I have a tattoo. I do not have a tattoo.
Not a real tattoo.
Temporary tattoo. Everybody wants to see. We have these. We just help. Oh, I will say we are running, even though because you joined us while we were at the event. Anybody who is not a paid subscriber, it's normally $175 for the year. We are giving the first 20 subscribers that join. You use the code FIRST20 to. Okay, well, I mean, why not?
Keep going from our.
So
I've got no problem.
You go to foodishealth.substack.com/first20 and you get the annual subscription for $100 instead of $175. But only 20 people get it. So, anyways, I might as well throw it out there. I know it's annoying, but
it matters because Substack helps on distribution, and if they get paid,
they push us higher.
They push it to more people, and if more people find out, then we all get healthier.
Well, and here's the other good news: is a number
payment and promotion.
Well, but it's going to pay everybody on here because here's the cool part: now that everyone is supporting us so much in terms of reading and joining these live streams, we have a lot of industry leaders that are doing the right thing for health that want to give coupons and freebies and fun stuff to our consumer audience. So those of you that are watching that are not in industry but find all this really interesting, watch, because our paid subscribers are going to start to get some cool stuff at the same time, discounts on the things that we talk about. So okay.
All right.
Everybody, we'll see you next week for another live stream after we're done.